Hello, Sao Paulo. This is Dr. Griffin Cole, and I'm speaking to you from Fort Collins, Colorado, although I wish I could be there with you in Sao Paulo. Listen, I am very honored to present to you the history of fluoride and water fluoridation because I'm going to tell you a very different story than what we were all taught and are still being taught out there in the mainstream public information. Fluoride is not the panacea that we've been told, and I'm going to share quite a different story here. So let's begin here. So I have several videos that I'm going to show you, and all of them are pro-fluoride. So but that's my way of trying to show you what everybody else is hearing, but obviously I'll provide some commentary after each one. Pay very close attention to this first one though, because it's about 2 minutes long, but I'm going to make commentary on several of the points.
Fluoride in our community water is a good thing. Here's why. Community water fluoridation is considered one of 10 great public health achievements of the 20th century. In fact, over 100 national health organizations recognize the public health benefits of fluoride in our community water.
It's so important that we prevent tooth decay, which can be a very serious disease if it's not treated. Water fluoridation helps adults as well as children. We have evidence on that. People are keeping their teeth longer, thank goodness.
It's effective.
I'm a mom, I'm a dental hygienist, and I'm also a researcher. And I like to wear all three hats. I always try to find the best science and evidence when I'm trying to make decisions about my children. And fluoride, especially through community water fluoridations, is one of those no-brainers.
It's safe.
Fluoride in community water is absolutely safe. It's been used for over 70 years to help prevent tooth decay.
Thousands of Americans are being misinformed about the safety and benefits of fluoridation. Now, if they go to a credible source, if they go to CDC, the Centers for Disease Control, if they go to the American Dental Association, if they go to ilikemyteeth.org, when they go to credible sources, they get the facts, the true science, and information.
I have absolutely no concern about community water fluoridation harming the children. I'm actually more concerned about not having fluoride.
Fluoride is natural. It's a fact that fluoride is naturally present in soil, rivers, lakes, and even the ocean. Water fluoridation is the addition of fluoride up to the recommended level for preventing tooth decay. It's similar to fortifying other foods and beverages, like fortifying salt with iodine, milk with vitamin D, orange juice with calcium, and bread with folic acid. It's preventive.
Why do you need to treat a disease when you can prevent it? It makes sense to prevent disease.
Okay, so let's comment on a couple items here. So first of all, just because something is done for 70 years or whatever, doesn't necessarily mean that it's been effective. Okay, that's just more status quo. Iodine, vitamin D, calcium, and folic acid are all essential nutrients. Fluoride is not. There is no bodily process that requires fluoride to work. Nobody will ever die from a lack of fluoride. It's a very clever way, the way they lump fluoride in with actual essential nutrients that are needed for life. So pay attention to things like that. And also remember, this one guy said, go to credible websites. And one of them he mentioned was ilikemyteeth.org, because we'll get back to that later on. Okay, so I want to talk about the history of fluoride just briefly. It's a very, very sordid tale. It would take me probably 2 hours at least to go over the full history. Needless to say, it has a very strange beginning. But I think it started with from a very altruistic standpoint with this man, Dr. Frederick McKay, a dentist in Colorado Springs, my state. In 1901, he started noticing that children that were in his town had these sort of brown spots on their teeth, but also had very few cavities, and thought there may be a correlation, which makes total sense. So unbeknownst to him at the time, he would embark on a 30-year investigation as to why this was occurring. Now, eventually he found out that that was naturally occurring calcium fluoride, which does have an anti-cariogenic effect, but is much safer to the body than what's actually added to our water supplies, which I'll get to in just a second. Enter this man. This is Edward Bernays. He's the nephew of Sigmund Freud, and a master in marketing and public relations. He was so good at what he did for the tobacco industry. They had hired him years ago when they were trying to make cigarettes popular, and the tobacco industry had a lot of money and was lobbying everybody they could to get behind their product. Edward Bernays was hired to make it something that was not only acceptable, but actually sort of a sexy thing to do. And he worked with Hollywood directors and producers and got them to have the women start smoking in the movies, and even went so far as to have them dress in a certain color blouse or dress that matched the exact color of a cigarette's packaging that he was trying to help promote. So, you know, you can work with the brain and either subliminally or just absolutely directly and get people to start to do things that maybe they don't want to necessarily do. You can get into this in great detail. There's a lot of men involved in other companies like Alcoa, which is an aluminum manufacturing company and has fluoride as a waste product, by reading Christopher Bryson's book, The Fluoride Deception. It has great information on all of this. So what is the ADA's position on fluoride? Quote, the American Dental Association unreservedly endorses the fluoridation of community water supplies as safe, effective, and necessary in preventing tooth decay. This support has been the association's position since policy was first adopted in 1950. What is the position of the International Academy of Oral Medicine and Toxicology? This is a large group of dentists and physicians and other healthcare practitioners. We have about 1,200 members worldwide, and I'm very proud to be a very big part of this group. So this is our position. Given the elevated number of fluoride sources and the increased rates of fluoride intake in the American population, which have risen substantially since water fluoridation began in the 1940s, it has become a necessity to reduce and work toward eliminating avoidable sources of fluoride exposure, including water fluoridation, fluoride-containing dental materials, and other fluoridated products. And we went on to have our position paper created by myself and a few others. And we spent a long time on this, by the way. We looked at all the science, and I'm going to cover a lot of this as we go along. So why are we concerned? Well, a few reasons are this. One, as I mentioned, there are a lifetime of exposures of fluoride. It harms both children and adults. Infants who are bottle fed use tap water as the main ingredient, and that can be very harmful. Obviously, swallowing toothpaste is not good for you, and it can cause a higher incidence of a lot of health effects, which we'll cover as we go along here. So let's start with the quiz. When fluoride is added to drinking water, fluoride comes out in the saliva and hardens the enamel and reduces tooth decay. The answer is false. Only minimal amounts of fluoride are found in saliva. John Featherstone, a very reputable researcher, back in 2000, published an article on the effects of fluoride in the Journal of the American Dental Association. This is our main trade publication. And he showed that the amount of fluoride is too low to show any measurable effect on acid breakdown. So his results of this very detailed study were that drinking fluoride in the water has little to no effect on the teeth. The only effect that you can really get is topically, which we'll cover here a little bit more. Drugs.com is a popular site online, and this is what they say. Sodium fluoride in drinking water, which, by the way, sodium fluoride is not added to any of the water supplies in this country, and I doubt it's applied to any of the ones in Brazil or the other 25 countries that fluoridate. It's always a hydrofluorosilicic acid, which is a waste product from the fertilizer industry, and we'll cover that in much more detail soon. But nonetheless, they say sodium fluoride in drinking water or taken as a supplement does not usually cause any side effects. However, taking an overdose may cause serious problems. And here's a list of them, and they're very long, and that's just a small list of them, but I wanted to try to get it all on one screen. So hopefully you guys can see that from where you're sitting. So let's press on with our quiz. Fluoride in enamel makes it more resistant to tooth decay. We've been told that. I even mentioned it earlier. The answer is false. The prevalence of dental caries in a population is not inversely related to the concentration of fluoride in enamel. And a higher concentration of enamel fluoride is not necessarily more efficacious in preventing dental decay. Granted, we're playing with some wording there, just like they do, but again, John Featherstone showed this, as well as many other researchers. So although fluoride does have a topical effect, and I'm not disputing that, it's not quite as strong as we've been told. And again, that topical effect, which I'll show in just a bit, when you change hydroxyapatite to fluoroapatite, you actually weaken the enamel. So here's what the CDC, the Centers for Disease Control, say about topical fluoride. 1, it enhances remineralization of cavities. 2, it inhibits or stops demineralization. And 3, it has an antibacterial effect. Let's assume all of those are true. You can do all 3 of these things without ever drinking a single drop of fluoridated water. Remember, that's a systemic effect. This is all topically done. And that plays a very important role, which you'll see as we go along here. So everybody always wants to know, okay, if I can't do topical fluoride or a fluoride varnish or whatever, what else can I use? And so I'm going to give a few things here that are great alternatives to fluoride. Number 1 would be povidone iodine or nascent iodine. Nascent iodine is a little bit more easily absorbed into the body. But let's just work with povidone iodine, where you can just rinse with this for 60 seconds and spit it out. You can do it very irregularly, 4 times a year, 6 times a year, and still get an incredible antibacterial effect. Let me show you a study that backs that. This was from the School of Dentistry in San Juan, Puerto Rico, 2002. And what they did was they had some patients where they applied, that they rinsed with povidone iodine. They did it 6 times a year, so every 2 months. And then another group that they did, they applied 4 parts per million fluoride varnish, also 6 times in a year. And these were the results of who was cavity-free after 1 year. 91% with the povidone iodine and only 54% with the very high amount of fluoride. MI paste, also called minimal intervention paste. Its main ingredient is recaldent, which is basically casein, which is from, cow's milk. But look at all the things that MI paste can do, right? It can also guard against acid erosion, prevents plaque buildup, reduces bacteria, and the list goes on and on. You guys can read that. So as a dentist in my practice, I would use MI paste without fluoride, of course, for either patients that had rampant decay and I wanted to maybe make trays where they could put the paste in it and wear it at night while they slept. I also used it for people who had radiation therapy because, as you know, when you have radiation therapy, particularly head and neck, your saliva dries up and you have a very dry mouth. So this is a very good alternative to using, say, a fluoride varnish. Ozone. I teach ozone therapy, so I always like to mention ozone. Ozone is an incredible antibacterial, in fact, antimicrobial, antibacterial, antiviral, antifungal, antiparasitic agent. It's incredible. And this is just a little list of some of the things that ozone breaks down. So you can see, 63 different bacteria, including all of the oral, 15 viruses, 25 fungi and mold spores, 13 fungal pathogens, and even encysted protozoa, which are very hard to get to. Probably the only thing that ozone wouldn't break down would be like a bacterial cyst, like say at the tip of a failed root canal. Those are incredibly difficult to break down and penetrate, and even ozone has a hard time of doing that. But I would say this is the most important, and I think most of you Brazilians know this, is our diet, right? We need to have an alkaline diet. If our pH is alkaline, then acid attack can't happen. And also in the presence of high amounts of oxygen, which is why I mentioned ozone therapy. But, some green leafy vegetables, grass-raised animal flesh, if you're into that. You can see on the list here green drinks and other foods like sprouts and wheatgrass and things like that. So if we have a sound diet, that's gonna be the number one thing to help you prevent getting cavities over anything else. And I don't think we talk about it enough, so I just have to mention this. I think it's a very, very important part of our oral health as well as our overall health. So let's talk about some of fluoride's effects. 1, it poisons enzymes. Why this is so important is that enzymes run every single metabolic process in our body. So if we're going to poison the enzymes that are in our body happening all the time, sitting here as we speak, then you're going to affect every organ in the body. It affects your blood sugar levels, increases your glucose levels, calcifies the pineal gland. So this is where we make melatonin, and this is so critical, right, for our sleep cycles and everything else, our energy levels. So fluoride, this is the #1 gland that's affected by fluoride. #2 would be our kidneys. It decreases thyroid function, right? Fluoride's going to beat iodine to the thyroid all the time. It's the most powerful halide. It's going to win every time. I had plenty of patients over the years that had thyroid issues, hypothyroidism, things like Hashimoto's, and when they got fluoride out of their lives, and what I mean by that is they installed a water filtration system at their home. They had filters on their shower heads. They obviously didn't drink any fluoridated water, no fluoride toothpaste. All those things, when they got out of their lives, their thyroid levels started to come back to normal. And as I just mentioned, impairs kidney function. Kidneys are where we filter out 50% of our fluoride. So when we ingest fluoride in any form, 50% goes to our calcified tissues and stays there, our bones. 50% our kidneys get rid of. Children can sometimes retain up to 80%. So that's why we talk about children and fluoride a lot more. But keep this in mind. Calcium fluoride, much easier for the body to get rid of and metabolize. Hydrofluorosilicic acid, which is what is added to most of the water supplies, all of them here in this country, probably most, if not all, in your country as well, is not easily metabolized and easily excreted. We'll talk about that more in just a bit. It lowers IQ. Why this is so important is this is the big news today. If you guys don't know this, here in this country we have a division of our government called Health and Human Services, very big division, and one of the groups in that department is the National Toxicology Program, the NTP. Their job is to look at all hazardous substances that are out there and not only inform us of them, but either get rid of them or eliminate them or reduce them as much as possible so that we're safe. Well, fluoride, according to the NTP, is a neurotoxin. In other words, pregnant women who ingest fluoride were bearing children that had cognitive impairments, including lower IQ. And our academy, speaks we're very outspoken about this. And we did a campaign, our own PR campaign, to get the message out that this is very, very critical, because if this gets to everybody and everybody hears this, and eventually a lawsuit that is going on in this country settles the way it should in favor of this report and getting rid of fluoride from our water supplies, this will end water fluoridation, hopefully on a worldwide scale. I'll talk a little more about that in just a bit. Obviously, it causes our bone to be fragile. You remember I mentioned earlier that it alters the collagen makeup of our enamel on our bones. Dental fluorosis, obviously, we know this, but it is an endocrine disruptor. It is a neurotoxin, like I just mentioned, and a cancer-causative agent. And this was proven back in the 50s. So none of this is news, but the lower IQ thing, there's been about 80 studies worldwide, and the NTP, they looked at 52 of what they thought were 55 incredible studies and came out with their recommendation that, wow, this really does cause all these IQ effects and cognitive impairments. So Compendium is a journal that we get here in the States. Maybe you guys get it as well. And they were looking at silver diamine fluoride, SDF, which has about 5.9% fluoride in it, which is not a huge amount, but still a fair amount. And when it came out, it was really just for sensitivity. So they would apply it to, say, exposed roots or wherever they had to sensitivity, and it would help. It would knock it out. So they started saying, since it has fluoride, maybe we can use this to manage caries. And so in this country, the National Institute of Health is, I think they're allotting about $10 million to certain universities to prove that point. But I'm thinking, what could possibly happen if we attached silver diamine fluoride and wiped it on people's teeth? And yep, that's no joke. Maybe some of you have used this stuff. It leaves a permanent black stain wherever you apply it. That's not going to go away unless you restore it. So not exactly my idea of a good option to stop decay and or sensitivity. All right, let's get into fluoridation. You guys should know this right from the beginning. 5% of the world fluoridates. That's it. 95+% does not fluoridate. In this country, most places do, most states do, pretty much all large cities and quite a few small towns. So we're about 75% fully fluoridated in this country. I don't know the numbers in Brazil, but I know you guys do fluoridate. And as I mentioned earlier, there's about 11 countries who fluoridate, but at less than 50% of the population. In the USA, we fluoridate more citizens get water fluoridation than the entire world combined. Not good. Okay, this is from a peer-reviewed journal here. This is Panacea. This is recent. This was this year, just a few months ago. And this was a literature search. So sometimes researchers will look at what's already existing in the literature out there, like on a PubMed search or other web-based databases where you can find out, find articles, find out if they're peer-reviewed, where were they published and all that. And they looked at they looked at 31 databases, including PubMed, Embase, and Web of Science. And they were looking to say, is there a correlation between mothers, again, who are drinking fluoridated water and or infants being raised on fluoridated water and ADHD, attention deficit and hyperactivity disorder. And they concluded that, yes, there is definitely a correlation between the two. So this is what I was talking about when I talked about the National Toxicology Program. And this was one quote from them after they looked at all these studies. Quote, an increase of 0.5 milligrams per liter in water fluoride concentration, approximately equaling the difference between fluoridated and non-fluoridated regions, corresponded to a 9.3 and 6.2 point decrement in performance IQ among formula fed. So again, we're talking about children here, and I feel like, there's no dose control when you're fluoridating water. A bottle-fed baby is going to get 250 times what natural breast milk provides. So likewise, if a 300-pound, 6'5" man can drink much more water than an infant, yet an infant's going to drink much more water in regards to their body weight than that 350-pound man. So there's no dose control, and that's the biggest issue with water fluoridation. So this was, as I mentioned, we, the IAOMT, did a little PR campaign of our own to get the truth out. This will sum up what this NTP report said and why it's so important.
Dentists in many cities are helping to bring the benefits of fluoridation to children. Now, our children can have better health through fluoridated water.
After 78 years of being told that fluoride in our water supply is a health benefit for us, science has proven that is not true. Unfortunately, it's just the opposite. Fluoride in our water supply actually causes neurological damage. I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. The National Toxicology Program, a division of Health and Human Services, recently released a draft report entitled Fluoride Exposure and Neurodevelopmental and Cognitive Health Effects. Their report, which analyzed 52 peer-reviewed studies from around the world, found that ingesting fluoride was linked to brain impairments in babies. The studies also found attention deficit disorders and lower IQs in infants born to mothers who drank fluoridated water during pregnancy and in babies fed formulas mixed with fluoridated tap water. Although pro-fluoridationists have tried to downplay this report, even going so far as to erroneously claim that all the studies have been debunked, the NTP has stated that they only reviewed high-quality studies that carried out precise scientific methodologies with controls and accounted for all variables. According to the Fluoride Action Network, the lead plaintiff currently involved in a landmark fluoridation court case against the EPA, the NTP document is the most peer-reviewed and scientifically scrutinized NTP report in history. It's disappointing that the release of this report is being blocked by Health and Human Services and other government agencies who promote water fluoridation and was only released after a court-issued subpoena. The release of this report and its findings are a huge win for the health of all individuals unnecessarily exposed to fluoride and those who advocate against the dangerous practice of water fluoridation, as it puts us one step closer to ending the use of forced medication in our drinking water. To prevent cavities without the risks of fluoride, nothing beats good oral hygiene. Floss and brush your teeth daily. Eat a healthy diet that includes plenty of vegetables, good fats, and ample protein, and of course, reduce sugar consumption. To find a fluoride-free dentist and for more information, go to IAOMT.org.
Did you guys notice that it was Health and Human Services, the very agency that houses the National Toxicology Program? They were the ones trying to block this from being released. You guys remember I mentioned Edward Bernays earlier? He's the PR genius, and this was one of his quotes that he says: "Propaganda becomes vicious and reprehensive only when its authors consciously and deliberately disseminate what they know to be lies, or when they aim at effects which they know to be prejudicial to the common good." So, this next video is of a physician named Dr. Aaron Carroll. He has a little thing called Healthcare Triage. He's a pediatrician and a professor of pediatrics at the Indiana University School of Medicine. And I guess he's all-knowing about everything medical, but he doesn't know a whole lot about dentistry. But let's just play his video and then I'll comment after.
To the research. Overwhelming evidence has existed for over 60 years that proves the efficacy of water fluoridation. Some of the best studies come from the early days of fluoridation because it was easier then to find groups of people who were not exposed to any fluoride sources. In a 15-year landmark study from Grand Rapids, Michigan, children who received fluoridated water from birth had 50 to 63% less tooth decay than children from a nearby city in Michigan who drank non-fluoridated water.
Okay, first and foremost, that was not a 15-year study. It was a 5-year study. And this is important because, you know, that's already a bold misstatement. 5-year study. It was supposed to be 15 years, but after 5 years, the powers that be thought, we've got enough evidence, let's just go ahead and start fluoridating, and thus Grand Rapids, Michigan became the first fluoridated city in our country. But I can tell you, and I'll show you later, the largest study ever on water fluoridation gave completely false results. And let me tell you this. So in 1986, the National Institutes of Dental Research and the NIH embarked on a very long study, and it started off with pretty good. I felt like it was a pretty good study. It was 39,000 school children in about 84 communities, and they were comparing fluoridated versus non-fluoridated. But let me tell you how you can play with science here. So that number that Dr. Carroll gave, 50 to 65% less cavities, that's just silly. That was coined by Dr. Harold Hodge, who was the head of the Manhattan Project. You guys may know that. But he also was the guy that you would see wearing the white coat on all the videos saying that 1 part per million is exactly what we need in our water supply to prevent cavities. It's just all basically random numbers. The true number that this study I just mentioned to you in 1986 came out with was 18% less decay in fluoridated areas. Now, that number's high. I mean, I would feel like, wow, 18% is pretty good. They actually had up to a 32%. If you look at this graph that's on your screen there, you'll notice on the x-axis, on the bottom axis, that's the ages of children, and on the y-axis is these percents of children that had less decay, basically. Now, what they're showing you here is the relative difference. And it's important to know that relative is basically grouping all age groups together. The absolute difference is looking at one child's mouth and all of the 128 surfaces in one child's mouth. That's how you're supposed to report your findings. What is the absolute difference between children? Relative, you just lump everything together and you can play with the numbers a bit. So remember what this graph looks like. So this is the absolute difference. It doesn't look that different, but notice the y-axis numbers are much smaller. Now let me put it on the same graph. There's the difference. So the red line is actually what the true difference was. And I say this because the Safe Water Foundation actually gathered all the data from that study and went through it over a long period of time. And guess what they came up with? It wasn't 18% less decay. It was 0.6% less decay. One surface of one tooth in one child's mouth. That was the true difference that they came up with. So, again, you can look at the science here. You can do your own study, and you will find that we've been lied to about a lot of things. Okay, so you guys know what the NHANES report. NHANES is the National Health and Nutrition Examination Survey. NHANES does really deep studies into what's already out there. They do basically door-to-door surveys. They look at a lot of health assessments. They just basically try to confirm what we've already known through science. So it's pretty detailed. And this came out in the Journal of Dental Research. Chris Neurath is a brilliant researcher, and Lineback and Osmondsons were very brilliant dentists as well. So let me show you what they found. So they were looking at fluorosis, as you could see on the cover of the journal there. But I want you to notice when you look at your screen there, so this is 12 to 15 year total prevalence increase. So in 1986, 1987 NHANES survey, they found there was 22% to 41% jump. So in that years, it was a 22% amount of children that had fluorosis. In the 1999 to 2004, it jumped to 41%, and the 2011 to 2012, it jumped to 65%. But look at the bottom paragraph. The rate of combined moderate and severe degrees increased from 1.2 back in the 80s to 30.4% in 2011-2012. Now those numbers seem incredibly high, but these guys are really thorough. But look at this. So I mentioned, I think I mentioned, if not I will now, the EPA and Health and Human Services had to lower the level that was allowed in American water supplies from a range as high as 1.2 parts per million down to 0.7 parts per million, or milligrams per liter, because they noticed that about 41% of the adolescents had fluorosis. Well, as we just showed you, it actually went up to 65% in one of the later surveys, and in the latest survey, 2013 to 2014, we're now seeing this amount. 87% of children have fluorosis on their teeth in this country. Think it's a problem or not? As I mentioned this earlier, I love this because I thought it was the end of fluoridation, but I was wrong. But in 2000, again, John Featherstone showed unequivocally that the only effect from fluoride was topically and not systemically. So let's get into some more science here. This is going to talk a little bit about the brain impairments that are so critical right now, because now we're talking about our children on a very profound level. So Bashash in 2018 in this peer-reviewed journal, Environmental International, they looked at about 213 Mexican mother-children pairs, and they were looking at urinary samples during pregnancy and then behavior assessments of the children when they were between the ages of 6 and 12. And they found an absolute, a direct effect from fluoride and children's attention deficits and hyperactivity. Likewise, in 2018, Christine Till and Environmental Health Perspectives. This was in Toronto, and it was almost 1,600 pregnant women. They measured their maternal urinary fluoride concentrations in spot samples collected during each trimester of pregnancy, and definitely found a connection again between cognitive impairments in children born to mothers who drank fluoridated water. Rivka Green, 2019, same year. This was in the Journal of the American Medical Association, Pediatrics Division. And the editors of JAMA knew this was going to be such a damning article that they, for the first time ever, had a little editorial comment before the article saying how rigorous this study was done. They thought the stats were incredible and it was worth publishing. And once again, we saw basically the same thing. Children's IQ scores going down to pregnant women who drank fluoridated water. We've all seen this graph or one similarly. This is just showing decay rates going down in all countries. Some of those lines are fluoridated countries, some of them are non-fluoridated. Try to guess which is which. You can't do it. So it's either better home care, better education. There's a lot of factors, but it's not fluoride. So remember the guy mentioned, a credible website like ilikemyteeth.org. So I went to that, and it's kind of neat in that they let people ask questions and then they answer it with what they think are truthful answers. So I'm going to try to make that sound a little less. So here was one of the questions. I found an article on the internet about something called fluorosis. Is that a reason not to fluoridate drinking water? And their answer was, a study published in 2010 found that mild fluorosis was not an adverse health condition and that it might even have favorable effects on overall health. I like to follow endnotes because I want to see where they're getting that from. And here's where they got it from. It's a news release from the American Dental Association. Not exactly science. Whenever I lecture, I like to show this because that's what I do. If I see something that sounds profound, I want to follow the endnote and see exactly where they got it from. You guys have all heard this at some point, right? Fluoridation is one of the 10 great public health achievements of the 20th century. What you may not know is that that phrase was coined by 2 members of the CDC's Oral Health Division. One of them's not even a dentist. So it was just a clever little word phrase there, and it seems like every Surgeon General in this country uses it every time they take the position. So it means nothing. Okay, what does the FDA say? Well, to date, the FDA has approved no fluoride-containing supplements as prescription or over-the-counter drugs because it's unapproved. And this is really sad because, you know, if the Food and Drug Administration is not approving fluoride supplements, how can they legally be prescribed and purchased from pharmacies? That's a big question. This is a woman, let's just listen to her. I like to hear what some people say about water fluoridation.
Fluoride has been studied for many, many years, and there's never been a scientific study that has determined definitively that fluoride is related to any health risks.
Okay. When you use the word never, that's a very strong word, so you better follow that. So let me show you how we can use the word never properly. There has never been a single randomized clinical trial to prove that fluoridation works or is safe. There's never been a long-term follow-up study to prove that it worked. And in fact, in San Antonio, Texas, that was my hometown growing up, so I'm very proud to tell you that San Antonio did not start fluoridating until the year 2000. But they did start in 2000. In 2009, Capital Metro Health Department did do a follow-up study where they went to see did adding fluoride to the water actually decrease the amount of cavities. You know what their findings were? There was actually a 13% increase in cavity occurrence, not a decrease, but no one ever said anything about that. And silicofluorides have never been FDA approved for ingestion and were never proven safe prior to putting in our water supply. Remember I mentioned that the water supplies don't add sodium fluoride and certainly don't add calcium fluoride. It's hydrofluorosilicic acid, a waste product from the fertilizer industry, a silicofluoride. And this was proven back in 1975 by a guy named Westendorf who was getting his PhD. He started off, he was going to do his thesis on the anti-carcinogenic effect of fluoride. And as he got into it, he started learning about these silicofluorides and proved that there was an incomplete dissociation of silicofluorides under physiological conditions. What this means is when a dentist tells you, so what, Griffin, if it's a silicofluoride or sodium fluoride, it all breaks down the same in water to the same fluoride. That is not true. That's so untrue, in fact, that I'm going to tell you this right now. Calcium fluoride, the naturally occurring form of fluoride, has an acute lethal dose of 3,750 milligrams per kilogram of body weight. Very high amount of that to actually kill a person. You know what the acute lethal dose of silicofluorides is? 125 milligrams per kilogram. 30-fold less. So it's not the same thing at all. So let's go back to Dr. Carroll and see what he has to say now.
The bigger cause of fluorosis is likely that kids do sometimes have a habit of swallowing their toothpaste. Fluorosis is the reason that the American Dental Association recommends that children under 6 do not use more than a pea-sized amount of toothpaste. We assume that little kids are going to swallow it, and if they swallow a lot more than that pea-sized amount, they're more likely to get fluorosis. Toothpaste delivers a much more concentrated amount of fluoride than drinking water does. So the biggest cause of fluorosis is likely swallowed toothpaste, not water.
Okay, listen, it's true, children can swallow toothpaste, but that's just a silly comment to say that that's what's going to cause their fluorosis over drinking, 0.7 parts per million in our water supply. Bottle-fed babies, they're going to get 250 times what's in natural breast milk. Natural breast milk has about 0.004 parts per million. So it's not even a contest when you're comparing the two. You can't control the dosage. That's the bottom line. So don't worry about all the words on the screen because I'm going to make it very bold and very obvious. But again, I like to follow endnotes to very important letters in this case, or of course research articles. So back in I think this was 2015 or 2016, the Public Health Service was looking to see if there was a connection between fluoride and cancer. So because there is. But the ADA thought, well, it behooves us to send a letter showing that that's not the case, that we can prove that fluoride has no effect on cancer at all. So they wrote this letter. And just look at the bottom there. But basically they're saying that last April that the U.S. Public Health Service noted that there was no compelling evidence that fluoride is associated with osteosarcoma. So let's follow those two endnotes. Number 4 is a press release from them. And number 5 is a statement. Okay, that's not science. The last sentence talks about that there was a 4-year evidence review, and after careful review, the U.S. Public Health Service concluded that the literature does not support classifying fluoride as a carcinogen. Let's follow that end note. That is a recommendation. Again, none of this is science, okay? Just because you make a statement or you do a press release or you make a recommendation, you can't use that as your end note backing up such a bold statement. You got to have science behind that. So you guys know, I don't know if you do know, but we have a thing called Fluoridation Facts. It's something that's on the American Dental Association's website, which I think they're now charging members a fee to look at, which is just silly, but they call it Fluoridation Facts. And I have gone through this and I can tell you that it is, very little of it is factual. They have about 359 references, and 98 of those, which is about 27%, came from things like I just mentioned, press releases or letters to the editor, internal documents, committee reports, monographs, lawsuits. None of it's science. The lion's share of the rest of their sources comes from a thing called CARES, a journal called CARES, which is not peer-reviewed. So let's look at a couple things here on their site. So, one of the statements in their facts says, fact, as discussed throughout this document, the best available scientific evidence consistently has indicated that fluoridation of community water supplies is safe and effective. And that of the thousands of credible scientific studies on it, none has shown health problems associated with the consumption of optimally fluoridated water. No studies have shown this? Well, according to the Fluoride Action Network, which is a very large network that you can find online, it's fluoridealert.org, an incredible group that does nothing but work tirelessly to try to end water fluoridation. But according to them, and you can back this up by doing your own medical online search, there are over 270 published studies on the kidney, 140 on the liver, over 350 on fluoride's effect on the brain, showing brain damage, 74 human studies showing reduced IQ, actually there's about 80 now, and over 200 animal studies and 33 cell studies. There's plenty of science. This is more on their website. It says water fluoridation is an effective and inexpensive means of obtaining the fluoride necessary to prevent tooth decay, and studies show that water fluoridation continues to be effective in reducing tooth decay by 20 to 40%. Let's follow a couple of these end notes. That first one is, again, a recommendation by the CDC. And this last one, it comes from their own fluoridation facts. So, I mean, I laugh because it's just silly. It's not, you're not backing it with science. This talks about the U.S. Preventive Services Task Force recommends the clinical use of oral fluoride supplementation starting at age 6 months through 5 years for children whose water supply is deficient in fluoride. Let's follow that end note. That is a final recommendation statement. Sorry. You guys ever seen this graph? This is kind of neat. This is showing that the amount of fluoride increase in the water, what happens to the caries effect? Does decay come down? And what happens to your fluorosis effect? Does it go up? So fluorosis is that sort of blue-purple bar, and the red striped bar is caries occurrence. You'll look on the x-axis, it shows the amount of fluoride added. We start off at less than 0.3 parts per million. You got a little bit of fluorosis, a lot of decay. You go up to higher to maybe 0.7, a little bit more fluorosis, still high decay. Go up to 1.2 parts, much more fluorosis, still high decay, and even greater than 1.2, a lot more fluorosis, and about the same amount of decay. So this was in the Journal of the American Dental Association again, our own trade journal. Okay, let's do some more science here. This again comes from Fluoridation Facts. Does the ingestion of optimally fluoridated water adversely affect the thyroid gland or its function? And they say that the best available science does not have an that fluoridated water does not have an adverse effect on the thyroid gland or its function, and a number of systematic reviews completed in the last 10 years looked at everything and showed no connection. So I'm going to play a little bit more with the EndNote game here. This says from this group called SURE, which is the Scientific Committee on Health and Environmental Risk, as requested by the European Commission. It states that, quote, a systematic evaluation of the human studies does not suggest a potential thyroid effect at realistic exposures to fluoride. And that is their own comment, and let's just assume that it's valid. Well, you do a little PubMed search, or you go on any database where you're looking for science, and look, here's one right here. The impact of drinking water fluoride on human thyroid hormones. This paper compared the measurements of the average amount of thyroid hormones in people with thyroid disease and people without it, and how fluoride had an effect. And sure enough, it absolutely affected the function of the thyroid gland. Here's another one. A comparative study of fluoride ingestion levels, serum thyroid hormone, and TSH level derangements, dental fluorosis status among school children from endemic and non-endemic fluorosis areas, 2014. The serum fluoride concentration significantly altered thyroid hormones. It lowers your thyroid function. Here's another one. Fluoride, thyroid hormone derangements and its correlation with tooth eruption patterns among the pediatric population from endemic and non-endemic fluorosis areas, 2018, the Journal of Contemporary Dental Practice. So, again, a positive correlation between fluoride, drinking it, and thyroid activity. How can the ADA not acknowledge this? Here's another one. Fluoride exposure and thyroid function among adults living in Canada. Effect modification by iodine status. This looked at almost 7 million adults in Canada, ages 18 to 79, who were not taking any thyroid medication at all. I'm trying to see some more notes here for you. So keep in mind, though, fluoride is going to beat iodine to the thyroid every time. Okay? Is the consumption of water at recommended levels harmful to kidneys? Answer. Consuming water fluoridated at recommended levels has not been shown to cause or worsen kidney disease. Okay? Let's just start looking at articles here. Now I'm going to try to again get a little bit of the sun out of the picture. Sorry. I want you to be able to see my face here as well as possible. The effect of water fluoridation on the development of medial vascular calcification in uremic racks. They're just looking at, again, fluoride is going to replace the hydroxyls of hydroxyapatite. They're going to act like it improves the strength of the enamel, but you're going to have this effect on your kidneys where you can't get rid of this stuff. The influence of fluoride on chronic kidney disease of uncertain etiology in Sri Lanka. This is 2020 in October. So again, they were looking at the effect of renal impairment on patients that had serum fluoride levels that were higher than those who did not, and found a direct correlation. Here's another one. Exploring the role of excess fluoride in chronic kidney disease review. So this is one that looked at a lot of studies that are already there. In fact, it looked at nearly 100 years of studies on the toxicity of fluoride on human and animal kidneys, and definitely found a direct adverse effect on people who had higher fluoride levels. So, this is also in the Fluoridation Facts. Does drinking fluoridated water increase the level of lead in the blood or cause lead poisoning in children? Answer. The best available scientific evidence has not shown any association between water fluoridation and blood lead levels. A number of reviews and data analyses indicate no association between water fluoridation and blood lead levels. Let's follow that end note. It's the SURE group again. Here we go. Neurotoxicology, this is in 2000, association of silicofluoride treated water with elevated blood lead. I think they looked at about 150,000 venous blood level tests taken from children's age birth to 6, living in like 105 communities in populations that went up to about 75,000. And they absolutely found elevated blood lead. So don't kid yourself. Fluoride will absolutely exacerbate lead levels. Here's another one in toxicology, 2010. Fluoride increases lead concentrations in whole blood and in calcified tissues from lead-exposed rats. So higher blood lead levels, again, have been reported not only in animals, but in children living in communities that receive fluoridated water. Here's another one, neurotoxicology 2007, confirmation of and explanations for elevated blood lead and other disorders in children exposed to water disinfection and fluoridation chemicals. Again, blood lead goes up. Keep in mind, guys, too, that when fluoride is added to water supplies, it breaks down the lead that's in these brass pipes. So whenever you hear about like for instance in Flint, Michigan, here in our country a few years ago, they had a horrible water issue that happened where all the citizens were getting this horrible brown water. And they admitted that it was lead in the water. But what they didn't tell you was, why did the lead all of a sudden show up in the water? The answer is, when you treat these pipes, and most of them are pretty old in most countries, particularly in this one, when you treat these pipes, you add hydrofluorosilicic acid to it, it causes corrosion like you wouldn't believe and breaks down those lead-lined brass pipes much quicker than it would happen naturally. And that's what causes the lead to come out in the water. So these are some sources of things that I covered today. There is so much to cover, but I had a little time limit here, and so I wanted to make sure that I covered all the highlights. Let me just say this. There is plenty of proof in the literature that you can find, anybody can find, that shows that not only is fluoride not effective in decreasing the amount of cavities in a population, but it's extremely harmful. I just showed you a few things there on the thyroid gland, the kidneys, and our brains. This is the biggest issue today, is that, at least in this country for sure, is that we have now shown and proven, there are plenty of studies to show that women who are pregnant and are drinking fluoridated water are bearing children with brain impairments. And this should be the end of water fluoridation. There shouldn't be anything more that we need to say about this. But unfortunately, the powers that be are pretty strong, and they're going to do what they want to do. So what I would say to you as a doctor and just as a human being who knows as much as I do about fluoride, it's up to us and you guys, grassroots movements, to get the word out there, to get information out there. Do your best at your local, if you have city council meetings or some kind of organized meetings, to start informing those people who are elected officials that they need to start doing something about this. I'm hopeful that this lawsuit that I mentioned here in this country is going to finally be adjudicated and ended, and the judge is going to come up with the right finding, which is that there's enough information out there now to stop adding this poisonous chemical to our water supplies. Listen, I was very honored to be able to present this to you guys. I'm hoping that next year I'll actually be there in person, because I'd love to meet some of you and have some time for some Q&A. I will give you my email address, because if some of you have some very important questions or any comments, I'm happy to answer them. It's griffincole@yahoo.com. So it's GRIF as in Frank, FINCOLE at Yahoo, YAHOO.com. I hope you guys have a great rest of your meeting. I was so honored to be able to do this, and I wish you the best.